Diabetes affects millions of people around the world. Whether you or someone you know is at risk, it's important to know the factors that can increase your chances of developing this serious condition. And trust me, some of them might surprise you. So, if you're ready to take control of your health and understand the top 7 groups of people at risk of diabetes, hit that like button and stick around. Number 1. People with a family history of diabetes. Family history is always a factor in many health issues, but number 5 might surprise you. Having a close family member, such as a parent or sibling, with diabetes significantly increases your risk of developing the condition. This is due to the genetic factors involved in how the body processes insulin. While having a family history doesn't guarantee that you will develop diabetes, it raises your vulnerability. It's also important to note that shared environmental factors like dietary habits and levels of physical activity within families contribute to this risk. Those with a family history should be especially mindful of lifestyle choices and engage in regular screening to catch early signs of the disease. Number 2. Overweight and obese individuals. Obesity is one of the most well-known risk factors for diabetes, especially type 2 diabetes. Excess fat, particularly visceral fat stored around the abdomen, leads to insulin resistance, where the body's cells fail to respond effectively to insulin. This causes blood glucose levels to rise, eventually leading to diabetes. Research shows that even modest weight loss can help improve insulin sensitivity and lower the risk of diabetes. Beyond diabetes, obesity also increases the risk of related complications like heart disease, hypertension, and stroke. Number 3. Women with a history of gestational diabetes. Gestational diabetes is a type of diabetes that develops during pregnancy and usually goes away after childbirth. However, women who have had gestational diabetes are at a higher risk of developing type 2 diabetes later in life. Research shows that nearly 50% of women who have had gestational diabetes will develop type 2 diabetes within 5 to 10 years. Additionally, babies born to mothers with gestational diabetes are more likely to become overweight or obese, increasing their risk of diabetes. Women with a history of gestational diabetes should undergo regular screening and maintain a healthy lifestyle to reduce their risk. Number 4. People with high blood pressure and cholesterol. Hypertension, high blood pressure, and abnormal cholesterol levels are closely associated with an increased risk of diabetes, particularly when these conditions are part of metabolic syndrome, a cluster of conditions that include high blood sugar, excess body fat around the waist, and abnormal cholesterol levels. High blood pressure damages blood vessels and reduces the effectiveness of insulin, contributing to insulin resistance. Meanwhile, abnormal cholesterol levels, especially high levels of LDL, also called bad cholesterol, and low levels of HDL, sometimes called good cholesterol, promote inflammation and insulin resistance. People with these risk factors should monitor their blood pressure and cholesterol levels regularly and adopt heart-healthy diets to reduce their risk. Number 5. People aged 45 and older. This may seem unfair, but just by getting older, you are now at risk of diabetes. This is primarily due to the body's declining ability to use insulin effectively as well as age-related muscle loss, which makes it harder to regulate blood sugar levels. Additionally, older adults tend to be less physically active, which further elevates their risk. While type 1 diabetes is typically diagnosed in childhood or adolescence, type 2 diabetes is more common among people over the age of 45. Preventative measures such as regular physical activity and a balanced diet are crucial to mitigating this age-related risk. Number 6. Women with polycystic ovary syndrome. Polycystic ovary syndrome is a hormonal disorder that affects women of reproductive age and is strongly linked to insulin resistance and obesity. Women with polycystic ovary syndrome often have higher levels of insulin, which can contribute to the development of type 2 diabetes. The condition also leads to weight gain, which exacerbates the risk of diabetes. Managing polycystic ovary syndrome through weight loss, regular exercise, and a healthy diet can help reduce the risk of developing insulin resistance and diabetes. Additionally, early intervention in women diagnosed with polycystic ovary syndrome can prevent or delay the onset of type 2 diabetes. Number 7. Smokers. Smoking has been identified as a significant risk factor for diabetes. Research shows that smokers are 30 to 40% more likely to develop diabetes than non-smokers. Nicotine and other chemicals in cigarettes cause inflammation and oxidative stress, both of which contribute to insulin resistance. Smoking also increases the risk of abdominal fat accumulation, which is linked to insulin resistance. Moreover, smoking exacerbates diabetes complications, such as heart disease, poor circulation, and nerve damage. Quitting smoking can significantly reduce the risk of developing diabetes and improve overall health. People at risk of diabetes often fall into one or more of these 7 categories. Each of these factors, whether it be family history, lifestyle choices, or existing health conditions, plays a critical role in the development of diabetes. For individuals in high-risk groups, prevention strategies such as adopting a healthy diet, engaging in regular physical activity, managing stress, and attending regular health screenings are essential in lowering the chances of developing diabetes. While some risk factors, such as age or family history, cannot be changed, many others can be modified through lifestyle changes and medical intervention, offering people at risk a way to prevent or delay the onset of this chronic condition. And there you have it. If you're in one of these risk groups, don't panic. Awareness is the first step, and making small changes now can make a huge difference down the road. Remember, it's never too late to take control of your health. Thanks for watching. If you found this video helpful, be sure to give it a thumbs up, share it with someone who might benefit, and don't forget to subscribe for more health tips and wellness content. Hit the notification bell so you never miss an update. Stay healthy, stay informed, and I'll see you in the next video.